Hi, my name is Teresa Kinjemi. I'm the owner and president of Medicare Made Simple, LLC. My clients affectionately call me the Medicare lady. I'm a Medicare specialist. But what does that mean to you? Well, I don't work for the federal government, for one. I don't work for any of the carriers, but I do have a contract to offer and sell their Medicare insurance plans. I'm an independent agent who offers between 7 to 9 different Medicare plans, like the Medicare Advantage plans, the Medicare Supplement plans, and the prescription drug plans. And also, I offer long-term care, dental, and final expense life insurance. I provide Medicare consultation, advocacy, and enrollment services for people who are turning age 65, qualifying for Medicare after 24 months of a disability, and to veterans who are eligible for Medicare but looking for more coverage outside what the VA benefits offer. Or simply if you need to make adjustments to your Medicare plan, such as finding a new one, to fit your current or changing healthcare needs. The video you are about to see is comprised of excerpts from my last keynote speech at the 2014 Alzheimer's Association Dementia Care Conference, so don't go away. Other advantages? I am celebrating over 5 years in business as a Medicare specialist, and I am commission-based, which means I get paid by the carriers and they get reimbursed by the federal government. A specialist should be considering you or looking at you as a whole person. What does that mean? They should be asking you questions to find out about you. What are your health care needs? What is important to you, and what do you want your Medicare health insurance to look like? How do you want it to help you and work for you? Because these plans really can be geared towards your health care needs. And guess what? Medicare has premiums, co-payments, co-insurance, and deductibles. It doesn't pay for 100% of all your costs. And the Medicare annual enrollment period runs every year from October 15th to December 7th. Most everybody out there in the marketplace is under the misconception that you can't make changes outside this annual enrollment period. You're stuck until this annual enrollment period comes around to make your change, and you don't have any other choices. Well, guess what? That's not true, because you do have options to make a change, or you may, outside the annual enrollment period. So I came up with this, the light bulb goes off in the shower, and Medicare, C-A-R-E, is health insurance. Medicaid, AID, is aid for low income. You should be asked by an agent, and hopefully the agent that you speak to is a licensed agent. And at your 25th month of illness or disability, you would be eligible to apply for Medicare and have all the same benefits as somebody who was turning 65. It's your 7-month enrollment window. So how does this work? When you're first eligible for Medicare, Medicare calls this your initial 7-month enrollment window. Once you go through this, you never go through it again. And then we're going to talk about what's been happening over the last couple of years with the drug gap or donut hole, and then we're going to talk about what's happening with the healthcare reform. Prescription drug plans have this prescription drug gap or donut hole. I want to talk about some resources, all right? So we talked about being financially aware, smart, savvy, start early. CMS, the Centers for Medicare and Medicaid, rate all the Medicare Advantage plans and the standalone prescription drug plans. They're rated on 5 stars. 1 star means the plan's doing poor, 5 star means the plan's doing excellent. So the plans, members rate the plans, and they're rated on staying healthy, managing chronic conditions. And what they don't know is that the VA doesn't cover 100% of everything. But a lot of the private Medicare Advantage plans, they could get their prescriptions for under an $8 copay. And the Advantage plans for the veterans, they could get dental, vision, hearing, gym memberships, hearing aids, possibly, depending on what plan they pick. So this is huge for veterans because they don't find out that they have, or the VA doesn't cover these benefits, or they have loopholes in coverage until the rubber hits the road. Hi, my name is Teresa Kinjemi. I'm the president and owner of Medicare Made Simple. We are here at the Dementia Care Conference, the 2014 Dementia Care Conference, and I'm here with Janine. Janine, what did you think about the conference today?
It was very informative. I enjoyed every moment of it. It's been really worth my time to be here. But the best part was Teresa's what you had said to me. I've learned so much in the last few minutes of your conference. I've learned more from you than I have from anyone else ever, even from Social Security or anybody, and I really appreciate that.
Oh, thank you for that. So you just listened to my Medicare Demystified presentation here today.
That's correct. And it was very, very informative, and it was very well given. Your speech was very well given, and you're very interesting to listen to, and I think that helped a lot.
I appreciate that. Thank you for coming today, and thank you for being a part of my presentation, and thank you for your testimonial here today.
Thank you so much, too. I really had a great time.
Hello, my name is Teresa Kinjemi, and I'm the president and owner of Medicare Made Simple. We are here today at the 2014, the end of the 2014 Dementia Care Conference, and I just gave a presentation entitled Medicare Demystified. I have Richard here, who is part of the presentation, who would like to tell you how he enjoyed the conference and what he learned from my presentation today. Richard?
Well, I was very impressed by the presentation. It was very logical. It started out at the very beginning to a person who may not know anything and gradually progressed through all the things that you'd have to educate a person about for them to be able to pick the right Medicare program that fits their situation. And I like the way you stress the fact that you try to help them understand so they can make the correct choice. You try to make sure that they're going to get the right plan for their condition now, their medical situation, their treatment plan, and as it changes through life, you're giving them information on how you can help them change it. So it's basically from A to Z, everything they need to know. And my impression was that I felt more comfortable understanding, and it appeared to me that everybody in the group, your audience, was much more at ease about a complicated subject that you simplified a great deal. So thank you for doing a great job up there.
Here's all my contact information. I look forward to hearing from you, and God bless.